Hello. Hello. Can you hear me, Madhumita?
I can hear you now, but I've completely lost you. Okay.
No worries. Let me come back to you. So
Yeah.
I was saying that when you are meeting these patients and their families
Hmm.
after a chronic disease, what are the typical symptoms which people come up with?
So the most common symptom that we notice is anxiousness, right? A feeling of hopelessness, uh, you know, if you call it pessimism. So, something around these lines where, you start feeling very hopeless, helpless around the situation that you're going through. You start feeling very irritated, right? Very easily frustrated, having anger outbursts. So these are certain signs and symptoms which we often notice. Sometimes it's also about guilt because, thoughts like, I could have done this better. If I wouldn't have done this, maybe my life would have been, not this that I'm living right now. Lots of interest in general, decreased energy, fatigue, difficulty concentrating, uh, memory becomes difficult. A lot of cognitive symptoms come. Sleep often becomes difficult, as you were also saying even in the beginning, right? So often sleep is one of the symptoms which starts coming up, right? Changes in appetite. Now, when I talk about sleep and appetite, it could go to any of the extremes, right? So it could be either oversleeping or it could be insomnia or undersleeping, or it could be overeating, which can again lead to a lot of weight gain, etc. And that itself is a risk factor for future cardiac issues, right? And it could also go towards lack of appetite. So either or can happen, right? They could also experience aches and pains in their body, like anywhere in the body, not just in the chest, but it could be heartache, it could be headache, it could be body pain, right? Because stress can often lead to aches and pains throughout the body. In the rarest of cases, not even rare, but there are times when all of these symptoms haven't been addressed for quite some time and hopelessness, worthlessness are quite high. We do see, death wishes coming up as well. So, and it's an alarming situation, right? So, there cannot be a delay once these symptoms are noticed.
Correct. So, Madhumita, can you tell us about, without, of course, naming someone, can you tell us about any incidents where somebody coming with a chronic disease and sharing what they feel so that our viewers can understand better that what they are feeling is not something which is happening just to them, but there are other people also who go through it. So, if you can maybe narrate one or two such incidences where people have come to you after their chronic illness.
So, not specifically cardiac issues, but then any chronic illness can have a huge problem,
Mm.
right? So, I remember, a young girl coming to me. She was in her mid 20s, right? So she suddenly got diagnosed with a condition called uh, idiopathic intracranial hypertension, okay, which is a chronic health condition wherein there's a fluid buildup inside your brain. Okay, so what does it mean? It means that she would have frequent extreme headaches, right, which would disrupt her normal life. She had just started working, right? And imagine the pressure of all of a sudden being diagnosed something with something like this. And she's no longer be able to lead a normal life, right? So frequent headaches was one of the symptoms. She would faint sometimes, body pains were there. She was advised strictly by her doctor that, you cannot take stress because if you take stress, your condition will aggravate. And what does
Correct.
aggravation mean? For her, it could mean that she could lose her sight, right? So that panicked her. Like, mid a person in their mid 20s losing their sight, life would be upside down completely, right? So that is when she reached out to me. So initially, when we started with the sessions, it was a lot about, why me? Why am I the person to be diagnosed with such a thing? All of a sudden, wherein my life completely changed. Right? I'm no longer being able to live independently, which was one of the things that she wanted because she wanted to move to a different country. Right? So every step that she takes from now on, she will need to think about it a lot more and only then plan and decide if that is actually a viable option, or probably she needs to change her life goal altogether, right? So there was a lot of, you know, grief around the loss of normal life. Uh, you know, to an extent, it could also contribute towards, forming new relationships at her age, which is very common, right? So, or anybody in their early, adulthood, they would want a engage, to somebody to fall back on, right? But at the same time, every time she would go and meet somebody, the often reaction is, "Oh my God, I'm not ready to handle them. So, let's not go ahead." So that would make her question as well. So it's not just the physical health. There are so many things you can see which gets affected, right? So the why me questions are very common among patients who are dealing with chronic health issues. Then, you know, the grief, the loss of the normal life, things that they love doing, right? A lot of things they cannot do any longer, right? So how do you cope up with that? So there is a lot of grief around that. And we in the sessions help them navigate through those griefs, making meaning of the new life that they have. What can they find out of the things that they have right now to make life better, right? So this was one case. Uh, there was another case I remember where uh, the guy was diagnosed with dengue. Okay, pretty common thing, right? But it went so severe that he landed up in the ICU. And soon he started having seizures after that. To an extent, he started developing, you know, sound, light, and touch sensitivity. So anybody coming and even touching him, he would, jump out of fear because that's too much of a sensation to take, right? And it was so difficult for him to take that information in that it might be like this forever, for some time at least. For seizures, they didn't have any well known reason, although we know that there could be some things like during dengue, your brain cells could be infected, right? So that could be the reason. But eventually, he had to deal with a lot of these sensitivities, anxieties, panic attacks around these things, and that was too much for somebody to handle who hasn't had anything of that sort until then, until that point of time, right? So he came to me for counseling to deal with his anxiety attacks, uh, the sensitivities that he was having, including sound sensitivities. He couldn't even step out of the house because the car honking outside is also too much for him to take in at that point. And a young person dealing with such things, it's very difficult if you have to go through it all of a sudden. So, yeah, those are just some of the cases. I mean, I could just go on. There are so many cases where people do experience extreme stress and anxiety after a chronic illness.
Correct, correct. And I can totally relate back to what happened with me back then, Madhumita. Uh, so I remember that at some point of time, even doing small things, you are always scared whether it is you can do it or not. So you feel quite at a loss of confidence. and then sometimes you become over meticulous about things, or maybe you don't pay, like you have said that some people overeat, some people stop eating, and both the things on overeating side kind of puts you at the risk, and on undereating side it kind of put you under nutritional deficiency. So in both the cases, these kind of disorders disrupts your life. uh, People don't feel like getting up from bed and talking to people. I used to avoid conversations with a lot of people at some point of time because I was not comfortable talking about my condition time and again. And not everyone you talk to is sensitive enough to kind of have a conversation which doesn't disturb you. So a lot of time when you discuss your condition with someone, their questions can be very blunt and it can make you feel really uncomfortable about this. So there's so many things which people go through, and uh, in my close family, one of my family member, they couldn't sleep because they couldn't actually digest this fact that this has happened in the family. So
Mm,
after a point of time, they were having problem in sleeping, and they had to start taking sleeping pills after a while because the body and the mental health was not in order at that point of time. So these kind of issues keep on happening, and I had my own journey when I was recovering. So I started to read how can I be a better person, how can I stabilize myself. And during the journey, I started being more meticulous in terms of how do I spend my time and become very regimental. But after that, I realized that your life can't be so regimental also.
I
So you can't run by the clock that I'll do this at this time and you do this. So it's kind of balancing out what needs to be done and how. So I'd like to ask Madhumita, as a counselor, what are the simple things when people are facing these issues? What are the simple things which people can do which can help them improve their condition and give them more relief or a little bit of comfort in the pain or grief they are going through? So, what could be those things that they could do?
So, I mean, first things first, of course, you have to eat a healthy diet, you have to exercise, because these are the basics, right? You have to do it. And not just for the patient, everybody must follow these things to live a healthy life. Right? Follow a healthy lifestyle overall. Right? So that is very uh, avoiding negative coping mechanisms like uh, consuming alcohol, consuming any kind of substances that can itself become like a risk factor and backfire. So avoid those things. Uh, find out stress relief activities. Like find out what you are comfortable with. That is very important. Some of the examples could be meditation. There are various kinds of meditation. Find what you can connect with most, what you are comfortable with doing. So those are certain. Uh, letting go of obligations that you don't really need to do everything.
Mm.
And there are things which you just may not take up. And it's okay to not take up, right? We take so much of stress thinking that uh, this is also something that I need to do. Uh, that is also something which I have to carry on just because people are expecting us to do that. But that's not mandatory, right? So let go of those obligations that you have to take care of a lot of things. Your health right now may not support it. And it's okay to take breaks, right? Ask for help. It is very much needed. Just because you're asking for help doesn't mean that you're weak. Many people cannot accept that and they keep on taking a lot of responsibilities and do not ask for help. But life isn't same as it was earlier. So it's okay if you delegate. It's okay if you ask for help from various kinds of people, right? Not just the family members, but understand what other areas can you reach out for help and seek help. It's okay to do that, right? staying in touch with family and friends is very important as a de-stressing factor because these are your loved ones. And no matter how difficult it is, there are times when you spend a you know, good few moments with them also. And those are things which you can cherish. Right? The next, and it's very important, I say, is making a list of things that you cannot do anymore, right? And find out workarounds for each of those limitations that you have so that you're no longer living on the grief. You're finding out ways to come out and still continue doing what you like to do, maybe in a different way, right? But that joy is not missing from your life altogether, right? Join a support group if you can. It's very, very helpful. And the last thing, which, according to Dr. Professor Andrew Shatte, who's a professor at University of Arizona, so he mentioned the hardest thing to, deal with a life with chronic illness is the ideal and real gap. The gap between the ideal life, things that you want to do in your life, and the real life, things that you cannot do probably in, right? So find out reasonable ways which you can achieve based on your present life situation, not what you had earlier. Okay? That will ease out a lot of these absurd life expectations that we have from us.
So true, Madhumita. In fact, sometimes happiness lies in very small things, and these setbacks. I think it's also about outlook. So sometimes we feel low, but if we look at these opportunities, these challenges as opportunities, and rethink about our life POV, then we see that they give us a moment to reflect. And uh, maybe it's up to us whether we see half glass full or half glass empty.
Absolutely.
The
Absolutely.
moment we start seeing half glass full, we start seeing opportunities. So I remember when I was recovering, uh, I was totally feeling hopeless at some point of time. That what should I do at 33 if you have had a heart attack? How do you make a career? How do you kind of make a family, move ahead with a normal life? So in those moments, very small things like it was around COVID when this was happening. So not of lot of physical resources were not there, but I took a simple course on story writing.
Hmm.
It was just my way of kind of finding an activity which helps me uh, share my thoughts, and writing always gave me a pleasure. So I started exploring, and I started learning to make apps at that point of time, just out of curiosity and fun, to get into something which was constructive and creative. And these things were helping a lot in kind of distracting me from negativity, because
Hmm.
otherwise if you are actually uh, sitting and not doing anything, you tend to get distracted to negativities, na? So you start feeling why this is happening, but then if you start involving yourself in something else, then your mind kind of gets distracted in other direction,
Hmm.
and you think about those things. Otherwise a lot of rumination happens at that time, na? So it's
True.
like you keep on thinking why this happened, or maybe same thought even if you don't want to think.
Hmm.
It's like again to you again and again, again and again. You are telling yourself, I don't want to think about it, but it's like big white elephant. Somebody is saying you that don't imagine that there's a white elephant in this room, and all you could do is imagine that white elephant.
Absolutely. And I mean, that's the reason we call it as negative automatic thoughts. They are automatic. They just, come and invade our minds, right? And we need to learn how to deal with them, right? But I mean, I would also want to give a word of caution over here. Yes, all of these things are very important, right? But at the same time, it is also very important to identify, acknowledge, and address and express the emotions that you're going through because of the chronic illness. If you're constantly trying to avoid them and not looking at them, right, it will find one way or the other to come and bug us, right? So it's important to sit with those emotions also. If they are coming often, right, it wants to tell you something which is important. And the more we try to avoid it, the more intense it becomes. So it's important. That's the reason, therapy is a space which helps in addressing these things. It helps you provide that space to sit and reflect on those emotions in the guidance of somebody who knows how to manage that situation, right? So, yes, positivity is important, but toxic positivity is not, right? So finding a balance there is also very important.
So that brings me to my next question, Madhumita. How do you find that when you should see a psychologist?
Mm,
Because there's a very fine line of difference when you are not able to understand that what I'm going through, does it need external help or should I talk to someone? And there are so many taboos. People don't want to talk, right? Uh, uh,
yes.
eh, when it comes to counseling, people feel that they are doing something wrong if they are going for counseling.
Mm,
That's a thought which comes to patients, to their families, and it's not just patients. Sometimes family members also need that kind of
Sure.
counseling.
Yes, yes.
So uh, how do people can actually identify whether they are in the need of counseling and they should consult professionals in
Mm.
what they are going through? So how can they understand it better?
So yes, it is a very fine line of difference, right? But if you are experiencing a chronic illness, right? Stress and anxiety just becomes the part and parcel of it, right? So even if you meet the doctor before you're supposed to meet the doctor, just reflect upon how many questions do you have about your condition.
Hmm.
So that itself will tell you how stressed you are about it, right? So if your sources of stress is constantly about your illness, right? Uncertainty about the future that you have, unpredictability about the disease, because you cannot predict constantly that what's going to happen, right? Disability, if it's financial difficulties that you're going through, right? All of these are very, very intense areas of stress, areas which causes stress, right? So one needs to reach for help if those are there, right? The other symptoms of stress which needs to be noted and people should reach out is irritability and difficulty in relationships. You're constantly irritated with your partner or anybody in your family members, uh, and whatever it is constantly irritating. And there's a sudden spike in that level of irritation, frustration, and anger that you're feeling, right? There's constant anxiety, tension, and low mood, sadness, right? Now, one day of sadness, definitely you do not have to meet a therapist, right? But if that sadness is there for a prolonged period of time, right? Let's say if it is there for 15 days and most of the days in 15 days, you need to meet a psychologist, right? If there's a loss of interest in things that you once really enjoyed doing, right? Say, for example, you enjoyed reading books, but all of a sudden you don't want to even touch the book that you loved reading once, right? So there's a significant drop in that interest. So this is known as anhedonia. So if there's anhedonia, definitely one needs to reach out for help. Disturbed sleep, whether oversleeping or undersleeping, extreme levels of fatigue, body aches and pains, including headaches if there are consistent headaches that you're facing, cognitive issues like difficulty decision making, memorizing, anything which involves your cognitive function, right? So, and disturbed appetite. Now, the problem with this is it's very easy to confuse them with the symptoms of cardiac conditions, right? You can have fatigue because of cardiac condition. You can have fatigue. You can have disturbed sleep or changes in appetite because of the medication sometimes that you're taking, right? So how do you understand? How can a general person understand and differentiate? The one way is if the symptoms have been happening for nearly 2 weeks, reach out for help immediately. Right? The other thing that I often say is, it's better safe than sorry. Get it ruled out, meet a professional, just get it checked that whether it is there or not. If it is not there, well and good. You will still learn some ways to manage it going forward. But if it is there, at least you can prevent it from getting worse. And again, contributing towards the already existing condition or something developed.
Correct. Very true, Madhumita. I can, thinking retrospectively, I can join the dots that how these things affects patients and their families, and how to identify. And you have rightly pointed out all these triggers like anger, frustration, insecurities about future, financial stress, your physical health. I think anybody who's a patient or family, I'm sure they have dealt with
Yeah.
these issues and challenges at some point of time or other. So, uh, very very pertinent points. Now, uh, if somebody is visiting a counselor or a psychologist, uh, who's a patient or a family member, what are the things that they should ask counselor uh, that they can get the right kind of treatment for their condition?
Right. So some of the things which are very important for the psychologist to know, and based on this, they will advise a lot of things to you, right? Not even advice. If you're going to a counselor, you would get advice. But if you're going to a therapist, you could probably work with a lot of deeper issues and, why the constant negative thoughts are coming. If the constant negative thoughts are just related to the illness or in general towards life as such, right? So things which matter to us for, understanding the condition completely, the state, mental state completely is what is the condition that you're dealing with, right? Uh, any other conditions that you might be having may not be a chronic illness or maybe, right? May or may not be linked as well. But knowing that helps a lot, right? Uh, how is chronic illness affecting you? Right? What are your fears, apprehensions, the challenges that are linked with your family history of physical and mental health conditions or similar health conditions that you come with, your personal history of any mental illness. So these are risk factors to understand whether you can be a person at risk for any mental health condition and what needs to be prevented, right? What symptoms are you experiencing and for how long, right? Now, what should you ask a therapist, right? The most important thing, how do you manage stress? And when I say this, you would get a lot of very, very generalized solutions available on it, right? That may be applicable, may not be applicable for us, right? Each of our lives are very different from the other. Even if we have a sibling, even if we have a twin who has probably grown up in the same environment, but still their life is different. Their experiences of life is different, right? So, like I said, there are lots of generalized solutions, like, sleep on time, eat healthy, exercise, meditate. These are general solutions.
Yeah.
But then there are things which is specific to you, right? So understanding that and working on that is something that you need to ask your therapist. What are things that I can do specifically in my condition to help me either avoid a future complication or a further trigger at any point of time, or prevent any other chronic conditions in the future, right? So those understanding of those specifics which are related to only and only you, that is very important. So generalized solutions, you get it everywhere, very frequently available. But these specifics are things which you need to really work.
Correct, correct. And you are very right, Madhumita. Typically they are very general suggestions like you do exercise, have balanced nutritional diet. Of course, they are helpful suggestions, but uh, knowing how to do it is what people are looking at that point of time. So it's not that they don't want to do exercise or they don't want to have a healthy diet. They want to do it for themselves, but they are in a situation when they are not able to find the right way how to do it. And I think that's something which really comes in handy when you talk to a professional, because they handhold you in doing it. They are like your personal trainer at that time.
Absolutely. Absolutely. I mean, see, a simple example. If you are a cardiac patient, right, eating oily food is something which is definitely restricted, right? You need to make sure that you're not consuming too much of oily food. Now, how much oil is okay for you? Who is going to tell you that?
Yeah.
Your nutrition, right? So they will evaluate your present health status, all your blood parameters, your weight, your BMI, and then tell you what is okay for you, and not in general what is okay for everybody, right? Similar, how much sugar, how much salt is okay for you, not for everybody, right?
Correct.
So understanding these basics are very important. Even in case of mental health statistics. Now, as I said, these generalized solutions are available. You need to meditate. You won't imagine, Ram, how many clients come and tell me, I've seen this, that meditation helps, and I've tried meditating. But it is so difficult for me to even sit for 1 minute and do meditation. How do you even do that? Meditation is not for me. There is a way to do that. You need to learn it. You need to train your body for doing it, right? So that is important. And how would you learn it on your own? Because a lot of times these things are not taught to us. Unlike when in schools and colleges, you were taught that you need to do physical activity, you need to be in sport, right? But how do you take care of your mental health? Nobody taught you. So that
Absolutely.
is why it becomes so important.
Correct. Correct. So, Madhumita, moving on to our next leg of discussion, but tell us a little bit about how group therapies or patient groups can actually help patients and their families. What is good, not so good about them, and what they can expect from these things if they are facing any mental health issues after a chronic illness.
So not only just about if they are facing mental health issues, right? When you have a chronic illness, it is always good to join a support group. What is a support group? So support group is a space where people with similar health conditions, right? They come together, and the group is often moderated by an expert, mostly a therapist, right? So let's say a group of patients with an experience of heart attack in the past, right? Doesn't matter what timeline, like somebody experienced heart attack recently or in the past, all of them come together, and often there are different structures which are followed. So one is a very structured format for support group where each time you meet there's a specified topic on which the discussion happens, right? And the therapist is mostly a moderator, just initiating the conversation amongst the group. Therapist is not supposed to give therapy over. Okay, so that needs to be very clear. So you're not going to get therapy in a support group session. Support group is for people who have similar conditions, come together and talk to each other. Okay. Now, why is that important? You started the conversation today saying that a lot of them feel isolated. A lot of them start isolating themselves because it's too difficult to keep repeating what you're going through or explaining what you're going through to a lot of people because most of them don't have the experience, right? It's difficult for them also to understand what are you feeling, why are you feeling. It's easy for them to, oh, don't worry, it's okay, you'll be better now, right? Now, for a person who has gone through that, it's not so easy to chuck it up. So, being in a space where people come together with similar life experiences, you don't need to explain them the details why you are feeling what you're feeling because we have also gone through the same stage at some point in life time, right? The other thing is it's a safe space. So you don't have to be worried about being judged by the people in the group, right? So that's a ground rule for a support group. You're not judged by anybody. Whatever you discuss in the group, no matter how crucial or how high that information is, it is going to stay confidential within that group space. Right? Third, no advice is given. So therapists will moderate constantly. Fourth, it is constantly, you know, so you share what you do or what you have been helped by, right? So let's say you do a certain thing and somebody else is also experiencing the same thing. Something that you have done has helped you in that situation. So you could share that. You could share your experience. It's up to them. They choose whether it applies to them and they want to take it up as on, right? So it's a very open space where they can be themselves at least for some time and not be worried about, I have to again describe what I'm going through. It's known, right? And it's not just for the patient, it is also for the caregiver. So there are lots of caregiver support groups as well because caregiver stress is, is a very real. They do get burnt out as well. So finding a space for them to talk to about what they are going through, their frustrations, even that is very important.
Very important. I suddenly feel at a loss of words when this topic. But sometimes this lived experience which you have, you've rightly said that yeah, you can't expect everyone to understand. And when you find the people who have been through that situation, then uh, it gives you a feeling of comfort and openness that you can share your, open up your heart and share things freely with them. And it
Absolutely.
really helps because it calms you down. That feeling of loneliness, that feeling of helplessness goes away for a while, and you are not being judged. I think
Absolutely.
that's very important when you are at facing a lot of difficult situation in your life. Then having someone who's not judging you but is empathetic to your situation and knows what you're going through, it means a lot to the person who's.
So, and also, it's very easy to address the questions of why me also through a support group because you're seeing other people also in that same situation, right? So it's not just me. That thought also sinks in, right? And at the same time, you know that I'm not alone. And I have a group of people with whom I can rely. And that is very important.
Yes. They say, na, you find your tribe.
Yeah, absolutely. Absolutely. I mean, I'll give you an example. A very common theme when we talk about cancer, right? In a support group session is fear around death. Now imagine, can you talk about this with your family members? Even they will start getting triggered. They don't want to lose you, right? But it's a very valid fear. But you can talk about this in the group because everybody goes through. So there are very fundamental things which you cannot always talk to with your near and dear ones. And that is the space which you can open up to.
Correct. Correct. Thank you, Madhumita. Madhumita, before we kind of wrap up today's session, I just want to ask you a very simple thing that there are so many people. So CBD has actually become a big uh, it's one of the major killers across the world, and it is one of the biggest NCD non-communicable disease contributors. And the other day, I was reading that specifically in context of US, that almost 50% of the population in US they have at least one risk factor of CVD. It could be obesity, it could be hypertension, high cholesterol, alcohol, sedentary lifestyle. And I don't have the number with me right now in context of India, but in our country also we are facing similar challenges.
Right.
People who are at the risk factors of CVD, stress I feel is one of the major triggers. So what happens a lot of times, people say that you have a sedentary lifestyle, or people say that you are obese, or maybe let's say you are not eating proper nutrition or not getting proper sleep. All of these are other related to your stress. So if you are stressed, people go smoke, they consume alcohol, they overeat, or they eat food, etc. So stress is actually a very strong factor which actually controls a lot of lifestyle choices that we make, which contributes to CVDs, cardiovascular disease. So what could be the ways where people can deal with stress in a healthy way?
So the most important thing is, again, live a healthy lifestyle, move. It is very important, right? See, we are not designed, like physically, we are not designed to lead a sedentary life, right? Earlier, few decades back also, people used to literally walk miles a day to reach their destination, right? So, and when you walk, when you do any physical activity, there are certain anti-stressor hormones which are secreted in your body to deal with the physical stress that you're going through. And the same thing helps in the emotional stress as well, right? It's an anti-stress hormone, right? Now, because it is designed to get secreted only when you're physically active, today's lifestyle restricts that, right? We are constantly sitting. We are doing our desk job, or even if when we are traveling on a vehicle. Some of them are vehicles, right? So that this amount of physical activity that we are designed to do is not happening at all. So as a result, that increases the risk factor. So movement is something which is very important. Uh, any kinds of physical activity. It doesn't have to be exactly that you have to go to a gym. You can walk, you can run, you can jog. Anything is fine, right? You can dance. You can find your favorite sport or your favorite physical activity. So find that out. That is very important. Lifestyle. Okay? So overall lifestyle, not just the sedentary lifestyle, taking care of that, but eating healthy, right? Sleeping on time. It is very, very important. Today's lifestyle has become such that it's very common to, sleep late. 1 p.m., 2 a.m. at night is a matter of, everyday things for us, right? But your body isn't designed to do that again. Your body is supposed to follow the circadian rhythm, which starts when the sun rises, right? Not that you have to wake up at 4 a.m., not needed, but at least sleep at a designated time. Don't change that time every day, right? Wake up at a designated time. So there's something called the sleep wake up cycle, and you need to maintain that sleep cycle. That is very important. Your body eventually gets used to that, but maintaining that one particular time is something which is very important. Not changing it on an everyday basis. The next thing is finding your optimal hour of sleep. It's not a very generalized number, although there have been researches in the past which suggest that 6 to 8 hours is the optimal hour. What does it mean? It means that for majority of the people, that is the time which is needed. But even the recent researchers say that it's not 6 to 8, it's 7 to 9 hours. So find out if you're getting those 7 to 9 hours of sleep. And just because it's a generalized number doesn't mean you fall in that category too. So you need to find out what is your optimal hours. It could be 6 hours for you, no doubt. It could be 10 hours for you also, right? So understanding that is very important because if you're constantly depriving your body of that rest, it's very difficult for your body to cope up because that is the time when your body rejuvenates, right? And if there's a constant deprivation, it will lead to health conditions eventually, right? So these are certain things which definitely need to be maintained. And of course, taking care of the stress levels, learning how to manage your own stresses, right? What things can you do to help you feel better? Giving time to yourself. We have four quadrants of life. If we divide life, there is four equal quadrants that it can be divided into, right? Your professional life is just one sector of it. Then you have your personal life, where your family, your partner, your parents, your children, relatives, all of them come. The third is the social life. Even that is important. You need to give time there as well. And the fourth, which is the most ignored part, is the self, just you, right? So, what are you doing to fill up your cup, to take care of your physical and mental health? That is very important if you want to take care of your stress level. Do things that you enjoy doing. So even small things matter, as you said very rightly. So small changes matter a lot. Things that you love doing, start redoing them. Just because you're working, just because you're older, doesn't mean you have to give up on the hobbies that you once had when you were a child. Right? So those small joys matter a lot.
Absolutely, and I think you have summed it up real well. That these small joys matter a lot. So maybe they are small, but they play a big role in the way we live a happy and healthy life.
And
And thank you, Madhumita, for that beautiful message to all our viewers and to the patients, their families, and people who are facing any risk factors for heart health disease and trying to find a way to cope with it. So, thank you so much for sharing your insights with us. It has been lovely talking to you today. And to our viewers, I'd just like to tell that Madhumita, as a professional counselor, she is available. So if you want to talk to her, share your concerns, discuss your conditions, and take therapy, she will be more than happy to help you navigate these complex challenges. And you can always follow Madhumita on her channel on social media. We'll drop in a link here. And We will again meet sometime again, Madhumita, to talk about topic which is at the intersection of mental health and heart health. So thank you so much for being here with us, and with all lovely wishes from our viewers. I'd like to my gratitude to you for today's session.
Thank you so much, Ram, for having me today, first of all. And it was really a lovely conversation because this is also something which is very close to my heart. Uh, and one last message that I would want all the viewers, want to give for all the viewers is don't wait for it to happen. Take action right now and take care of yourself because everything else can wait. But if your health is at stake, nothing works at that point of time. So take care of your physical and your mental health. Thank you.
Thank you, Madhumita, for that beautiful message. Thank you for being here. Have a good
Thank you
day.
so much, ma'am. You too. Bye.